Hi, everybody, and welcome to County Talk, boring but important. As you know, this is where we talk about the nitty-gritty issues that we deal with here at the county so that you get to know the county better and you know where your taxpayer money is going. I'm Sue Hansen. I'm one of your 3 elected commissioners, and I'm here with Scott Hawkins, who is the our county emergency manager. And so I thought we would start off by just so people, not everybody knows what an emergency manager does. Well, okay, emergency and manages emergencies, got it. But, you know, there's more to your job than just that. So if you would give us an overview of what emergency management does and all the scope of everything.
Actually, I get asked that question a lot. What does an emergency manager do? It's always a bunch of different answers, but basically emergency managers are the local level of emergency management that the government, that basically then gets into the higher level of government depending on the size of the response, whether it's regional, state, federal support. Basically, it all goes around like the preparedness of, for emergency management, the, mitigation, recovery, responding. And then they also added like prevention and protection that got added in after 2011 to hopefully prevent terrorist attacks or man-made disasters.
Okay, so let's use a kind of a story narrative way to look at this. So a fire crops up. You're immediately called in to do what?
Basically, that's when I start coordinating stakeholders and partners, depending on where the fire was started, how that works. So it was a federal land, private land. We'll coordinate with state folks, BLM, Forest Service, Division of Fire Prevention Control. If it is a local or on a private land start, we'll start coordinating those peoples and stakeholders and getting those all connected together and how we're going to basically do the initial attack and then respond from there.
So, when you initially think about an emergency manager, you think about that you're out there actually battling and sometimes you are out there on the ground, but a lot of your job is the framework and the organizational structure about an emergency, right? Who's doing what, who's going where, that sort of thing. And just I don't think everybody really understands the levels because there is a local, a state, and a federal. And I think you could use the Bucktail fire as an example. We had a Bucktail fire start on private land, and maybe you could just kind of explain your role in that piece, because then maybe that's vivid enough to imagine for people.
Right, now it's fresh in our mind. And as you said, emergency managers are usually never really boots on the ground. We will sometimes help depending on the size of the incident, but most of the times we're behind the scenes. We're doing what we call agency administrators, coordinating the pieces, the PIO pieces, for all of that. Everything
PIO?
Public Information Officer,
right.
and getting the word out and making sure that our messaging is clear. So we do a lot of that. We're calling in the resources. We're dealing with the state to make sure those resources are tracked and paid for, everything to that nature. And as you mentioned, the Bucktail fire was really good because it was a multi-jurisdictional fire. Started on private land, went over to
And when it started on private land, it was the county responsibility. So we had our guys even out there helping Road and Bridge. They were helping at that point. Is that correct?
That is correct.
Okay.
Yep. It's a county. It's the county's jurisdiction to start the suppression of that fire.
Okay.
And then when it exceeds our capabilities, then that's when we'll delegate it to other jurisdictions.
Or it goes on to public land. So in the case of Bucktail, is that what happened?
That is what happened.
Okay.
Bucktail burned through some private land and went into Bureau of Land Management land.
Okay.
Burned through Bureau of Land Management and then went to Forest Service land.
So we had all the jurisdictions. Everybody was involved at that point.
Right.
Okay. And then there's a lot of other coordinating things that you do. And I think that using the fire, which we also know that no structures were really affected. Is that the case?
We lost a cabin.
Yeah. But that very different from an urban fire, because in an urban fire, you would have a lot of structures at risk. And so that would be a different response.
Greatly different response to an urban or to more of a populated area where we're doing evacuations, sheltering, and then you get into the the warning systems and all of that stuff. So our role in a more of a populated or rural area or even becomes much greater, because then we're way further into consequence management. If we unfortunately lose residents or something like that, there's a lot of process similar to the Sims fire. We didn't lose a lot, but we lost enough to where it became very, there's a lot more pieces to the puzzle once homes are lost.
Right. Yeah, it gets more critical at that point. Yeah. So this fire was a fire that didn't threaten necessarily any structures, and so did the Forest Service let it burn because was that part of the strategy?
With this fire being that it was not a natural start, they cannot, per policy, let it burn. They can manage it, but they can't just let it go.
Okay.
So it had to be a full suppression fire, being of the nature of the cause of the fire.
Mm-hmm. So I think people don't, and I know you're not in the fire line of service, but you do, that's one of the big things that we've done. And when I first came into office, I think we had I want to say it was the mailbox
fire then.
Anyway, and we had to sign off over the declaration to the state and all of those things.
That might have been the bull draw fire.
Bull draw.
When you first came into office, yes.
And what I learned a lot of what an emergency manager does do, and this structural piece, like making sure the meals were there. That's not directly but you make sure that happens, and you kind of facilitate those resources to get on the ground, right?
Right. We do a lot of resources, and what you had mentioned, like the delegation of authority. We also did that on this bucktail fire.
Okay.
Once it exceeded our capabilities as a county to suppress the fire, and it was moving fast, we did a delegation of authority, which every year we do an annual operating agreement with the Division of Fire Prevention and Control and our partners that if it exceeds our capabilities, that we'll sign a delegation of authority, basically handling the control of the fire over to the Division of Fire Prevention and Control. That doesn't mean we hand everything over to them. We're still agency administrators, and you as county commissioners make a lot of those if there's financial decisions and everything.
Right.
That doesn't take that authority away from the county.
Right. It was, that first fire was scary just because I kept thinking, oh my gosh, could we be on the hook for tens of millions of dollars? I mean, these fires are very expensive to be able to battle. So I was a little concerned about that, but I think I have to get it out of my pocket.
That's one of my jobs and duties is to make sure that, that stuff is taken care of.
Keep your commissioners calm.
Yeah. It's not possible.
Yeah. So, so we've talked a lot about fire because I think it's a good way to illustrate what your job is about. But even when I first came in, I guess I had all my disasters up front because we had the Happy Canyon. We had that flood, so I got to do sandbags and all that, and emergency management was on the ground. That's another example, and I think we have a flood picture. This isn't Happy Canyon. This
one's the Chavano Valley flood that happened in 2021.
Okay.
That's when that flash flood came down through the canyon and flooded the valley.
Yeah.
So
that's a lot of water. So what was your role on this?
Again, I was there to initial response because we did have some emergency situations there to assess it. That's one of the first things I'll do is I'll go in and assess, and we will basically look at the severity of the damages to see what level of response that's going to take. Do we need to just go regional, state, get state partners involved, do damage assessments to see if there's any, help from the state, or do we need to do a disaster declaration? Neither one of these did get to that level where we need to do a disaster deck, but this one was fairly close to that.
Yeah, it got close. I remember when that whatever you call that cube.
Connex box?
Connex box, yeah, it was floating down. It was a little...
Thought it was going to take out our bridge.
Yeah. It's not funny. I mean, but you don't, when you live in Western Colorado, you don't really think about floods, but especially people that are new to the area. But, we have dry, and then we have monsoons, and so it's not unusual.
It's not unusual. We're really susceptible to the flash floods. We'll get those thunderstorms that come and just dump a lot of rain in a very short period of time.
So let me take a step back and ask you how'd you get into this? I mean, what's your background and how did you find your way into emergency management?
It was a long road.
Well, you're not that old. No.
Well, we'll just
miles.
skip that.
Is that what you're saying? The miles, yeah.
After I graduated high school, I actually got a job here at our airport. It's just an operations, doing the ground maintenance stuff. But back then, the operations section of the airport also did aircraft rescue firefighting. So I went to Texas A&M, got my certification in aircraft rescue firefighting, which we call ARF for short. Worked at the airport for a while, transitioned there, went to college. But after that, I got on with our Montrose County Sheriff's Posse back in several decades ago. Was on the Sheriff's Posse for quite a while, even was president through that. And then fast forward for a couple of years, I got into law enforcement. Was at Durango Police Department for years, and then before I moved back to Montrose in late 2013, did a few things, and then I started working at the Center for Mental Health here, our regional health center or mental health center.
Yeah.
So I spit that out. But one of my job descriptions there was to develop the disaster behavioral health team or program, because at that time it didn't exist.
Mm-hmm.
So I did that for our 6-county West region through the Center for Mental Health, and that got me involved in a lot of emergency managers on the healthcare side and on the all hazard side, just like my job is now. And got my foot in the door there. Met some really good people over at the hospital and everything, and just that progressed into being the Healthcare Coalition, the West Region Healthcare Coalition Readiness and Response Coordinator, which was kind of that role of doing more emergency management for healthcare industries, not just disaster behavioral health. So just that kind of transition, and I was in that role for a couple of years, 3 years, until this position opened in 2019.
Well, you kind of have had a pathway, if you think about it. And I remember during COVID, we were doing the preparation plans for if we had, mass casualties, I guess. I don't know if you'd call it that, but where we were looking at the schools, setting up the beds and things like that.
Alternate care sites and all that stuff.
Yeah.
What a great time to get into emergency management was right before a pandemic.
Yeah.
So.
Yeah. Good timing.
Right,
well,
good timing.
No time like the present to learn
Right.
what you got to do.
Yeah.
So your background actually kind of led you to this, which is really great.
I've always enjoyed first response and helping people and being there for and helping community members. Like I said, I've grown up in this community and always kind of wanted to stay and help the citizens of our community.
That's great. So, so has there been any surprises, things that you didn't expect that you would be dealing with in
A pandemic would be
Well,
the
okay.
first one.
I guess that was a surprise for all of us.
Yeah,
huh?
that was, huh? Well, like just the amount that emergency managers really are just required to do. Our job is other duties is assigned is a long list of other duties is assigned, and emergency management has evolved, especially even in the last 5 or 6 years since I've been in it here at the county level. It's just really grown and expanded. Other mandates from the federal government, state government, just other duties, obligations that come down the pipe. It's just really grown and expanded of what our roles and responsibilities are in emergency management. That was one of the things that I found it's just kind of overwhelming on sometimes is how many times we have to shift gears during a day just doing different things that we're required to do.
Yeah. I think it's, when you think about planning for a community in the event of something that you hope isn't disastrous but could be disastrous, I think is pretty awe-inspiring when you think about all the pieces that have to come together for like a safe evacuation or a safe handling of a situation like a plane crash or something like that. And you just did that. You just had a full-scale training, which is part of the whole process of what you do, is put together people so that you can help get people ready for just in case things that happen.
Right.
So tell us about what happened here.
So this is our triannual mass casualty exercise that we do for the airport. The airport's required every 3 years to do this. And then the 2 years prior to that, we do what we call tabletop exercise. That's where we all just sit around a table and basically go through the scenario, but we don't necessarily act it out. This year we did the full-scale exercise where we get the role players, everything. We respond to the airport and everything to that nature as it's try to mimic the best we can a actual
So you have the hospital folks out there. They're bandaging people. I mean, are they actually doing all of those things? Or
we didn't go to that extent this year.
Okay.
What we did is we took papers with names on them and then what their injuries were, and we put the papers out. So when the fire department responded, they could see, and then we had those same pieces of paper at the hospital.
Okay.
So they say we're transporting this patient. And then we had actors at the airport and actors or volunteers at the hospital, but we didn't actually have to transport them between the two agencies for safety purposes.
And is that something that you do every year, every couple of years?
Every 3.
Okay, every
for the
3
airport
years.
is every 3.
Right. So, and that's probably even at that, there'll be snafus when you actually have an accident of this magnitude that you were pretending it was like a plane crash of 160 people or something like that.
Yeah,
So
180.
180.
Yeah.
Okay. So yeah, I think it's really it's great that we do this in preparation for the what ifs, and hopefully we don't have any what ifs, but you just never know. I mean, that's the whole point of emergency.
And one of the great things about these exercises is, and that's a big part of emergency management, is the collaboration all your partners, stakeholders, other entities around the counties and everything to that nature. That's one of our biggest roles, is getting people together. You want to meet somebody during an exercise or a training, not on an actual event, right? So that's one of the things that we do in emergency management, is really bring all those people together. As you can see in this one picture, we had quite a few participants on this last full scale, and that's perfect that we can sit down and meet each other, hand business cards, and get to know each other prior to an actual event.
Sure.
So,
Yeah,
that's
because
a
I would
big
guess
piece of it.
communication is like key, right? So you have to be able to, connect and communicate the essential
Right.
orders or whatever. So, well, great. So I think we have something coming up, because, your job is not just on emergencies and responding, it's also prevention.
Right.
So tell us about what's happening here.
Yep, this is something that's coming up October 16th. Here, it's our annual flu clinic, a drive-through flu clinic that we hold here at the event center. We also at the community, the Olathe Community Park in Olathe, and then the Basin Clinic in Natarita. And we kick those off all at the same time, and it's our drive-through flu clinics. It's something the county does in collaboration with Montrose Regional Health, the Basin Clinic, River Valley Family Health. They help out a lot. City of Montrose, and of course, the commissioners. You guys budget for this.
Sure,
as well.
and you also Road and Bridge helps.
Road and Bridge help on the east and west end, and
Right.
the city public works help as well. They
Right.
help set up the traffic cones and direct traffic. Montrose Police Department does that too.
So how many do you expect this year? I think this is one of the the best organized events. And when I first came, pretty knocked out at how smoothly everything went. How many vaccinations will we be doing? And
This year's 800, hopefully,
Okay.
is what we have. And we have X amount of high dose, too. And one of the questions we always get asked in our public health department gets a lot of phone calls on this is, it's just the flu vaccine. It's not the COVID vaccine. We get a lot of those phone calls. It's like, are you also doing the COVID vaccine in there? No, it's not. It's just the flu vaccine. And we do have some high dose ones for 65 and older, but those are limited and first come, first serve. As is this. When we run out, we have to shut down.
so you just drive through with your arm hanging out the window. And
Well, not really. But you do have to stop and get the shot.
you have to
It's not
stop
a
and get the
drive-by.
shot. Yeah.
But this is our 10th annual one that we're doing. So that's really neat that we've been able to do that and sustain that for 10 years now. It's pretty neat.
Great.
And it's grown. The event center's been a huge help since that was built, because we stack the cars outside, then we go back and we go inside, so it's more of a climate controlled if we have bad weather. Works out really well.
All right, so everybody's just waiting in line to drive through, get through the event center, and then they get their shot along the way, just sort of like this.
Yep,
Yeah.
you can see some of the rows there.
Yeah.
The picture on the left is where we basically the outside queue where you go, you get your consent form, you fill that out, and then you come inside, and that's where we have the nurses and the medical teams providing the shot.
Great.
We also do have a walk-in side that if we see a vehicle with more or kids in car seats, because it's really hard to give a shot in the arm with a kid in a car seat, so we have a walk-in side at the event center as well.
And don't we have a couple of pediatricians that kind of
do.
hang out
Yep.
and make sure that those kiddos
Dr.
get...
Vader comes. She's
Dr.
awesome.
Vader, she
and
is awesome.
she's
She's a community awesome person.
She is, and
Yeah.
we're thankful to have her. And
Yeah.
every year she's there to help.
So as we kind of wrap up, what else would you want our viewers to know about emergency management and, how to get in touch with you and that sort of thing?
Well, we have our websites and everything. One of the things also is our community alerts. That's something we've been really working on is regionally is a new emergency alert system, and that's still evolving. We're still working on that. It's been a process. The county did purchase a system called EVAC, which goes along with the emergency alert system where we have zones. So that's still in the process.
So the
too.
community would be divided into zones in
Into
case something
zones.
happened, and you would be able to touch base
Right.
with certain zones. And
Yep.
so when would that be finalized or finished? Or
I'm hoping by the end of the year.
Okay.
And that comes along with an app called Genesis Protect that it's free to download, obviously, and we can alert people through that app. You don't have to sign in and go and register like our typical, opt-in alert system. You can just download the app, put the zone that you're in, and you don't have to sign up for nothing. You don't have to put your name in there, and you'll still get those alerts.
So is it easy for like an elderly person to sign up? Because I
Super
think that
easy.
would be tough.
Yeah,
Okay.
super
okay.
easy.
Good. So if somebody has some questions about preparedness, and if we were already here, would they contact you at your website, or where
Yep.
would they call you?
Or I don't have my email address
Okay.
up there, but on the website it has my email. Just feel free to give me a call or email me. I'd be more than happy to answer any
Okay.
questions.
Well, thanks for taking the time
Absolutely.
to stop by and talk about
for
emergency
having me.
management. I think it's really important work that you do, and I think people probably don't understand how much, because you're applying for grants, you're doing a lot of
lots of grants.
paperwork. I mean, you're there. It's more intensive than people really think it is about. So
Yeah, in the 5 years that I've been here, brought in over 600,000 in grants.
Mm-hmm.
So that's a big thing that we do. There's a lot of money out there, and we're still working to do some more mitigation grants to do fire mitigation and prevention.
Good.
So we're still looking at that with Colorado State Forest Service and some others. So
Good. Well, it's really been a pleasure to talk to you.
Thank
And
you, Sue.
if there's anything else, we'll catch you on the fly on the next time we get
Yep.
together. But hope you learned something about emergency management. Hope that you realize that the county is preparing for these kinds of things. Scott is in charge of making sure that we are that we have everything in place to be able to do that, including practicing. So contact us if you need to, if you have any questions. But thanks for joining us on this episode of County Talks. Boring but important.
thank you, Sue.
Thanks.